Thank you so much for joining us. Most of us here in Canada are used to the way our healthcare system works. There's not a lot of choices there. How does it work in Australia? Could you walk us through that a little bit?
Yeah, sure. So the short version is I'm going to start by saying Australia does have a universal healthcare system, and everyone in Australia is covered with the public healthcare system. So the public healthcare system in Australia, which we call Medicare, and I brought a prop along, so everyone in Australia has one of these,
Nice.
Medicare card. And with that, you can access all public healthcare in Australia, which covers most things that most people would need. So half of our country only has public healthcare. I only have public healthcare, right? So it's quite a common, quite an effective system. Then in addition to that, we have the option for people to buy private healthcare. Now, I want to point out, it's sometimes misunderstood. People think that the public and private healthcare systems are in competition in Australia. That's not really true. We've got the public healthcare system that everyone receives, and that is like a base that everyone gets. And then some people, about half the country, choose to also get private health insurance to top up. On top of that, which comes with a few perks and a few extras. You got a choice of surgeon, a choice of hospital. You can go to the private hospitals, and you can sometimes choose the timing of your surgery. So there's a few benefits from private health insurance, although it must also be said, one of the reasons so many people in Australia have private health insurance is the government penalizes rich people for not having it. So the government really does try to encourage richer Australians to contribute more into the healthcare system by pitching in and buying private health insurance, which obviously frees up resources for the public healthcare system and just ensures there's more resources in healthcare, full stop, across the board in Australia. So
That
that's
sounds
the
pretty
short
novel.
version.
Okay, that's neat. Okay, I was just about to ask you that then. What incentives are there? Are there carrots and sticks, or how does this work? That might be a Canadian term. What other incentives are there to get wealthier people, richer people to buy their own health insurance?
No, it very much is carrot and stick. So the carrot applies to everyone. The carrot is basically a subsidy for private health insurance. And that's, well, I guess it doesn't apply to everyone. If you're rich enough, you don't get the subsidy either. But the subsidy also applies to, to low-income people. If they want private health insurance, they're certainly welcome to get it, and they get a healthy subsidy. So that's the carrot side. On the stick side, for individuals earning over 90,000, 90,000 Australian, I think that's about 80,000 Canadian dollars. I'm just going to speak in Australian dollars.
Okay.
For individuals earning over 90,000 or families or couples earning over 180,000, that's where the stick kicks in. If you are, that's considered like a higher income earner. If you don't have private health insurance, you have to pay an additional 1 to 1.5% effectively income tax. We call it the Medicare Levy Surcharge. What it functionally is if you're a richer Australian and you don't pitch in by buying private health insurance, you pay a slightly higher income tax, 1 to 1.5% higher. So that's the stick side. And the combination of those two things means that when people are earning over $90,000 or 180 for families, there's a very strong incentive to buy the private health insurance. And as I said before, the benefits of that, you get some benefits, right? You can choose a surgeon and have more say over the timing of your surgery, for instance. But the broader benefit is that it just ensures there's more resources going into healthcare. Right? So you've incentivized higher income Australians to be pitching in more resources out of their own pocket, either directly by buying private health insurance or indirectly by paying the Medicare surcharge. And that frees up space in the public healthcare system, which still works very well for the rest of us, the simple people like me who only have the public healthcare.
I would be in the same boat if I were in Australia for sure. So this is the scenario that everybody dreads. So God forbid you get into a car accident or you step off the curb and you get hit by a bus. You have to go to the emergency room. How does that work? How is that paid for? Do you need to have healthcare by credit card? Is there a big bill at the end of the time? Is it different if you have private or public health insurance? How does that work?
This is my answer. So I'm not sure exactly how it works in Canada, but my suspicion is it works the same way. So if you have an emergency, you go into the emergency room, that's all entirely covered by Medicare. And that's true. If you have private health insurance, it's not relevant here. It's covered with Medicare. So Medicare will cover all of the costs associated with the emergency room visits. So that's fine.
It's
That's
interesting.
the same for everyone. I think it's the same for my country as it is for yours in that instance.
It's very similar. To give you an example, just anecdotally, because I have a lot of healthcare workers in my family, I know for a long time, I don't know if it's still the case here in British Columbia, an ambulance ride you'd actually get billed for it later. It was around $50 or so. But then it was an argument over whether or not it was truly an emergency. So I think, God forbid, in the trauma situation of a car accident, I don't think you're billed. But I guess it's up for debate whether or not it's truly an emergency. Then you get the ambulance bill. So that's very interesting. And then there
Well,
are
I can just say on the ambulance cover in Australia, that one is actually done state by state. So we don't have a national. So this Medicare card is an Australian Medicare card. So all Australians get it at a national level. It's not a state-based thing. This is the federal government pays for the expenses for Medicare. Ambulance cover is run at a state level, and we have different rules in different states. So the state I'm in, my rates covers free ambulance cover. So my ambulances are covered. If you happen to be interviewing someone from New South Wales or Victoria, that have a different answer. So that's a little bit of an extra confusion for the Australian system.
See, healthcare is largely funded by the feds here. There's still some supplementary provincial tax levels and things like that, but it's managed by the provinces. And so our Medicare cards are provincial ones, and it changes province by province. Ours has a big sunrise on it. Alberta will have a wild rose, et cetera, et cetera. So
sorry if I may just follow up on that one. Our system is the same. The states provide public hospitals, but the federal government basically pays for the public hospitals. And so I guess it's a small difference. It's just that our card is federal.
Your card is federal. Okay, that might actually be more efficient from a taxpayer perspective. It's more generic. They don't need to print off a whole bunch of different graphics. So what about something that's not an immediate emergency? What about somebody who needs, say, a hip replacement or a knee replacement? How is that different between the healthcare that you opt to pay for privately or the public system? Are the wait lists different? How does that work?
Yeah, so they would both, the procedure would start the same way in both instances. You'd go to your GP, and we haven't really discussed how the GP system works, but it's perfectly possible to find GPs that you can see for free in Australia, just using your Medicare card. And then from there, you'd go and see a specialist. Sometimes there would be top-up fees to see a specialist. They would charge more than the government covers, but it's quite manageable, a relatively small amount. And then you'd arrange to go in for a surgery. And if you just have the public health cover, then the surgery is entirely covered. You go into a public hospital and it's entirely free. If you have private health cover and you go to a public hospital, the public hospital does get the private insurer to kick in. So then again, you have that extra resources coming in to boost the amount of money going into the health system that way. The additional benefit if you have private health cover is you can have some say, you don't have infinite say obviously, but you have some say over the surgeon and the timing.
Interesting.
So that's the benefit you get. If you're on public health cover, you have to then obviously, as is the case in all public health cover, wait in line, wait to get to the front of the line, and then you get the surgeon you're given, which that's not that bad a thing. Australian surgeons are pretty good. We've got a decent education system here, so it's not like any of our surgeons are doing backyard operations. No. So it's perfectly adequate, but the benefit for the private health insurance recipient is some additional choice.
Interesting. And so I'm also guessing that post-surgery, that if you have private insurance and you pay a little bit more, you can maybe have a private room or something like that. Is that true too for recuperation? I know, for example, after you've had a baby here in Canada, in a lot of cases, you can have a special top-up if you have like dental or optical or something through your health your worker. You can have a special little thing where you can get a private room. So you can actually get a little bit of rest where you're not rooming in with somebody else. Is that an option there?
Yes, you can get top-ups. Where that really is noticeable is that we have in Australia public hospitals and private hospitals. So public healthcare covers public hospitals or emergencies in private hospitals. Emergency rooms are covered for everyone, everywhere, always. But if you have private health insurance, then you have the option of going to a private hospital or a public hospital. And in some of those private hospitals, if you have the very fancy side of private health insurance, you can get the fancier and fancier rooms, all the way up to your fancy hotel type. I haven't experienced that. I'm very happy with the level of the public care down at my local public hospital. But yeah, those options do exist. And
different spin on there's a term hospital food around here where it's kind of a joke, but I could just imagine it'd be filet mignon or something fancy like that. We've only got a couple more minutes left here with you. What about a routine visit to your GP, to your general practitioner? How is that covered? Is it just wave the card and that's it, or how does that work?
Most doctors are running their own practices. They're all basically private practices. And they have a choice. If they want to charge you that $40, then they're charging you the same as the government subsidy. So in that instance, or you go in, wave the card, and you see the doctor for free. The doctor also has the choice of charging more than that $40. So if they charge, say for sake of arguments, they charge $50, and then it's a little bit more administratively annoying. You go in, you pay the 50, and then you go back, wave the card at the government, and they give you 40 back.
Ah, okay.
It's up to the doctors. It's about more than half of GP visits are free. We call it bulk billed. That's our name for if you can just wave the card and get a free visit to the GP. We call it bulk billing or bulk billed. More than half visits to GPs are bulk billed. Pretty much everywhere you go, you have a choice between seeing bulk billing doctors or fancier doctors that are charging a little bit extra and adding some bells and whistles. So I go to, again, a bulk billing doctor, and I'm very happy with my local GP. It's perfectly good for me. But...
Excellent. And lastly, I just wanted to wrap up here. Is there anything we've missed in asking you this, in the sense that you think there's a major difference between the Canadian healthcare system and the Australian healthcare system? And about for how long have you guys had more of a choice in healthcare? Has it been generally well received? Has that changed? When did the option of choice and top-ups and wealthier people opting into private insurance, when did that come into play?
You know, the interesting thing about, because I'm by no means an expert on the Canadian system, so I've had to learn a little bit more to learn how to speak to you. And the thing that I find remarkable, and I think most Australians would find remarkable, is the lack of choice. So the Australian system has always had the choice. Now, that doesn't mean the Australian system's always been the same. We used to have an option of private health cover, but without the carrots and sticks. And back then, people still had the choice, but far fewer people had private health insurance. So it was pretty much for the entirety of my adult life, we've had the current system with the carrots and sticks. And when the government introduced the system of carrots and sticks, then that pushed a lot more people into getting private health insurance. They always had the option to. It was never illegal. That's the oddity of looking at the Canadian system from the Australian perspective. It kind of boggles my mind. I'm sure there's a reason. I guess somebody has a reason. It's hard for me to see the reason why you wouldn't allow people the option of putting more money into the healthcare system, and especially, I guess, the way we do it, kind of forcing or strongly incentivizing richer people to pitch more money into the healthcare system. So there's just more money in total and more government money left over for low-income people. That seems
Exactly.
like a no-brainer to me, but I will, I guess, hold back from any further commentary on the Canadian system. I'll leave that for you guys to work out.
Well, that is why we have contacted you. We're constantly learning because we're trying to improve things for average people here in Canada. And it sounds like it's working well for you guys in Australia. Thank you so much for your insights today. We really appreciate it.
Thank you.